Hi everybody, I'm Dr. Lisa with Tri-State Veterinary Services. This is my assistant Ryan, and this is Jerry the goat. And today we're going to be going over FAMACHA scoring in small ruminants. So FAMACHA scoring is where we are looking at the color of the mucous membranes, usually looking at the lower or upper eyelid to determine an indirect determination of the level of anemia or red blood cell count in the goat. And that in hand gives us an indirect measurement of parasite load in small ruminants. As you may have heard, barber pole worm or Homunculus contortus is the leading cause of anemia and even death in small ruminants, especially sheep and goats. One way that we can easily assess the level of parasite burden in these small ruminants and help us with our parasite burden and control is FAMACHA scoring. So by looking at the color of the eyelids, we can determine the level of anemia or lack thereof level of anemia, and in turn decide if there is a high or low parasite load that needs treatment. So when we're doing FAMACHA scoring, I recommend that you have somebody to assist you so that you can have somebody holding the head or holding the goat while you work on them. The best way to do FAMACHA scoring is to either pull down on the lower eyelid while also pushing up on the top, and in doing so that will pop out that lower conjunctiva. Or in turn, the other way, you pull up on the top and push down on the bottom, revealing the upper conjunctiva. And as you can see, as I expose this, you can see the color. And as you are able to look at the different levels of coloration on the screen, you'll see that when it's the most red or pink, that is a 1 or 2. Those would be healthy, not anemic goats that do not need treatment. So in turn, we assume they have a low parasite burden when it comes to Homunculus contortus. Goats with a 3, 4, or 5 are becoming more pale in color. 3 being our question area that they may or may not need treatment. 4 being pale, likely anemic, and have a high parasite burden and need treatment. And lastly, a 5, which is severely anemic and in need for assessment as well as treatment for anemia and parasite burden. At Tri-State, we always recommend that when you're FAMACHA scoring, if you see one of your goats having a FAMACHA score of 3, 4, or 5, to collect a fecal sample from that goat, label it, and drop it off at the clinic so we can not only determine that Homunculus contortus is the parasite causing the issue, but also the egg count will be able to assess how our treatment protocol is working in the future. So just because you see the paleness in the color doesn't mean automatically deworm. It means collect a fecal and notify your veterinarian. I would recommend checking the FAMACHA score once a month. That way you can assess regularly where your animals are at in terms of their parasite burden as well as their anemia score. Animals that become anemic can go downhill pretty quickly. So having that regular checkup with your animals will make sure that you don't get behind. So again, easiest way, pull down on the lower eyelid, push on the top, and that's going to expose us. I would say Jerry is right around a 2, so I'm not concerned about him being anemic or him having too high of a parasite burden at this time.